Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Utilizable when they weren't utilizable before. And then, of course, that's the second one. And then the third is the fact that now that we have treatment for hepatitis C, we can now use people who are positive for hepatitis C as donors. We also have started using HIV positive donors for people who have HIV. So that these are things that can be done now because of the progress. And so as we talk about the fact that we still have a problem, we've gone from 22 people dying every day because of the shortage of donors to 17. But we really need to get down to 0 to 5. And that's something we have to try to do, to try to get as many donors as possible, and also try to take advantage of these ways that have been posed here as ways to increase the donation, expand the donation pool. We have about 100,000 people waiting for organs, and we transplant about 40,000 organs. So you can see the disparity of about 60,000 that has to be overcome. Any comments or questions about this article that we included today?
Yeah, Dr. Callender, what is the worldwide situation? You know, we talk about here in the United States, across the world, in Africa, Asia, Europe. What is the situation is? It pretty standard across the.
Yeah, it's pretty. Yeah, I think the United States probably has about the second or third best system. I think Spain has the best rate, and we're probably second or third. And Europe is pretty good, and countries in Asia and Africa are getting better all the time. So we have come a long way, but it's still not the same everywhere. But Asian countries, African countries, and European countries are all have organ donation and transplants programs for live and deceased donors. Okay, I guess we'll go to the next one unless there's any comment or questions. I guess this is no surprise that people with chronic conditions who go to jail are undertreated. Of course, asthma is one of the commonest problems that we have, and as minorities make up the most common population in jail. And of course, if you can't breathe, you can't live. And so this is a study that looked at the chronic health conditions in incarcerated persons and those unincarcerated, and it's no surprise that while this is probably just as true among those who are not incarcerated, because we're talking about the people who make up most of the jail are the Latino Hispanics and the African American populations. But it was much worse in the incarcerated population. Of course, the issue that really comes to mind is what are we going to do about it? And how are we going to get chronic conditions treated better in jails? And that is an issue. Of course, many have started thinking about letting people out of jail and getting back in society. But the question is, why can't we do a better job of treating them while they're in jail? And one of the issues is to continuously measure the quality of care among incarcerated individuals, and then also do something about it as we find the inequities as they exist. And of course, the one issue that is not addressed hardly at all is the issue of mental illness. And many of the people in jail may be in jail because of mental illness anyway. And the fact that in society, many people don't recognize that the minority population has more needs for mental health treatment than the other community. And one of the reasons is because of the violence that we're associated with and at a very young age. And so the fact that there's a stigma and people of color may not recognize that visiting a psychiatrist is important. It may well be one of the main reasons a lot of the people who are in jail today. It's one of the reasons. Substance abuse is another one. So I think it's an issue that has surfaced, an issue that is important to measure and not only identify, but actually do something about it.
Dr. Callender, are all men created equal?
Yeah. I mean, I think that they're created equal. After they're created, though, many things change. And not all, because there are people who are born who have birth defects. And so when you say all, I can't say all, but maybe 95% of people are so-called normal. But you have mental conditions and medical conditions, anatomical issues that, as we know about the people who are born with congenital malformations of all kinds. So to say all are created equal is probably not accurate, because all of anything does probably not exist. But so the answer would be no. The answer is no. We aren't all created equal. But those who are not as blessed as others and who have congenital and other malformations need more treatment and more care than those people who are the so-called normal.
Dr. Callender, I've noticed that if you look at the news, a lot of times, or especially more recently, when the police have encounters with suspects and they use violent force and they end up, hurting or killing the suspect, those suspects have mental illness, either that or that by itself or in combination with using drugs. So, and as we notice with the incarceration in general, most of those folks are either African American or Latino, Hispanic. So I think it goes across the board, not just who ends up in jail, but I think a bigger reason that they end up in jail many times is because of a mental illness.
Very well stated. And probably the biggest, there used to be the biggest problem was taking care of elderly. But now we have Medicare and those kind of things that take care of elderly. But we haven't really done much about taking care of mental health issues that are ever present. Any other comments?
Dr. Callender, the other point that can be made here is when they released everybody from St. Elizabeth. That didn't help.
Absolutely, absolutely. That was a tragedy, and they just went on the streets, and that's so insensitive. Our concern about finances was so important that we did something that was unconscionable. Okay, let's go to the next one. It's interesting. This is another. You see all kinds of ways of overcoming and preventing type 2 diabetes. Type 2 diabetes is the diabetes that we're more commonly associated with. This is the diabetes that occurs usually later on in life and is related to intolerant insulin that is not being able to be used by the body. So in some way, your body becomes unable to use your own insulin, and it is treated by many ways: exercise, diet, and in some instances, insulin. And so you have a number of ways of treating it. And I think one of the first things to do if you have type 2 diabetes is to try to lose weight and have an ideal weight, and decrease the use of sugar. And most people, many people, I should say, if they change their diet and lose weight, will be able to not need medications for the control of type 2 diabetes. But there are those for whom that is not enough. And this is one way of addressing it. This article talks about 3 days a week eating food and then having a 20-hour fast. And then the rest of the week eating whatever you want to eat. And they identified with this intermittent fasting, which they call this technique, that type 2 diabetes was preventable and also was treatable. And so this is just another way of treating type 2 diabetes. As is clear, there are a number of ways of treating it, but this is one way that they suggest. Although I wasn't as impressed because I didn't see the real data for it, but the intermittent fasting is not new. It's something that has been around for a while, but its specific use for the management of type 2 diabetes is what this article is all about. Any comments about intermittent fasting before we go to the next one?
I had a question about the type 1 diabetes. My daughter right now is having a problem because if she had type 2 diabetes, the insurance would cover her better than they would because she has type 1. And they claim that she is managing her type 1, and so the insurance won't cover her.
Well, that's interesting because type 1 is the type of diabetes that is more common in the younger people, and is the one that is associated with most of the diabetic complications, and is usually covered it's usually covered well. But if you have type 1, but you don't have it real bad, I guess that then becomes an issue, because under most circumstances, type 1 is covered by insurance as outside of the military. where there are issues, specific issues there. But
Well, that's
outside
the
of,
key point. That's the key point because she is in the military.
and that's the problem.
Yeah,
That is
that's the problem.
because, and outside of the military, it is covered pretty much nearly 100%.
Elizabeth has her hand up. Unmute, Elizabeth. Take your hand down. You don't unmute.
Good morning, everyone.
Good
Can
morning.
you hear me?
Yeah.
Yes. Dr. Callender, now, I'm not going to get into insurance because that's a whole different ball of wax. But do you think it's because they think that pre-diabetic can be controlled by diet?
No, now if your question is about type 1 or type 2, because type 1, that issue is truly a military issue. For type 2, I think if you have a diabetic, it's pretty much covered by insurance. Now, if you mention the pre-diabetic, that's another issue because you're not a diabetic. Actually, you're just likely to become a diabetic. But I think that the issue that the type 1 faces is really an issue that exists primarily in the military and not outside of the military. I don't know how that addresses the answer to your question because the question that was put on the table is really one that involves the military having its own way of dealing with issues, which is completely different from what happens outside of the military.
Oh, okay. What does your A1C has to be for you to be considered pre-diabetic?
Between 5 and 6.
Okay. Okay. Thank you.
Okay. All right. Let's go to the next one then. Now, this is something that I wanted to include because I'm not sure everybody understands what genetic testing is all about. And we just had a movie star who was concerned about Alzheimer's and had genetic testing, found out that he had copies of the APOE4 gene that increases risk of Alzheimer's 8 to 12 times higher than people with the most common version. And so if you decide to get that genetic test and you find that out about yourself, then does that frighten you or are you better off without knowing it? The question is something that is important, particularly for people of color. If you're going to get genetic testing, be aware of the fact that what you may find out may not be to your liking, or it may result in poisoning you in the eyes of many, especially the insurance companies. So that if you're going to do it with appropriate genetic counseling, so that you also do it, and so that whatever information it remains private and not achievable, and not able to be reached by people other than those you want to know about it. And also remember, you don't know what kind of information genetic testing will reveal. And so sometimes it may reveal that you're not really the father. And there are many other things that may reveal. It may reveal diseases that you don't really want to know about. So just getting genetic testing is not something you do willy-nilly, but it's something that you have to understand what you're about do and the implications on you and the rest of your family. So just keep that in mind. So when you decide to get genetic testing, do it for the right reason and do it in a way that your information is protected. And understand what risk factors mean. Risk factor mean that you're exposed to it, but there are ways in which you might modify your lifestyle that will allow you to not suffer the disease for which you have a high risk for. Now, at this point, many doctors tend not to order genetic tests because we have no effective treatment, which makes sense to me. Why do you need to know about it if you can't treat it? And so, of course, there's a lot of difference of opinion on this, but this is an issue. And so the question is, do you want to get genetic testing to find out if you have a high risk for Alzheimer's or other genetic conditions that may be helpful, may not be helpful? One thing that is important, though, is to have genetic counseling. Genetic counseling is not that common, and getting genetic counselors is more than a notion. And most doctors are not experts in genetics, and so it's important. You know, we have Dr. Addo, who is a geneticist, but most doctors are not genetically educated and empowered, and so you have to be careful and have an eye and really know what you're getting into. Dr. Addo, any comments?
I was thinking, Dr. Callender, that you know, what the same point that was brought up. If there's no treatment after you find out that you might have this predisposition, you know, why tell people that you know, it would be different. Okay, I've got a gene that makes me more than likely to have Alzheimer's, but there's nothing I can do about it anyway. I remember my mother's treatment really didn't do anything for her Alzheimer's. I don't think I would want to know if there was nothing you could do about it.
Any other comments? The floor is open. Okay, if there's no other.
Well, I got a question. Why don't we just focus on the ones that you can do something about?
Well, if that makes sense. This article is about the variant for which we can't do anything about. There are the genetic diseases that we can do something about. Sickle cell disease and some other genetic diseases we can do something about. But this is focusing on Alzheimer's, a disease for which we really don't have good treatment for yet.
Well, the broader topic might be eugenics, because, you know, eugenics is studying whatever hereditable traits you have and making decisions about whether or not you can do things like have children, whether you should be sterilized, and choices for employers could make depending on what your genetics are, or decisions that you might make according to who you may marry, because you may not want to marry somebody who has some Alzheimer traits in their genetics. So, you know, as long as people maintain their freedoms, despite knowing what their genetics are, then I guess everything is okay. But that's the issue. Like, what freedoms could possibly be denied with genetic testing?
Excellent point. That is the essence of the point I want to get across to this group, is that understand what you're getting into.
Dr. Callender, it sounds like it would be illegal for employers to use those kinds of things against you in terms of whether they're going to hire you or not.
Oh, that's true. It is illegal. But it's even better if you don't even, if they don't have any genetic information on you at all.
Well, okay, if you think about it, for any employment, you get a physical, including blood tests. You know, right now they say primary point of a physical is to make sure that you're not on drugs. But you do get a physical, so an employer right now is entitled to some medical information before you're hired. Right now, there's no laws that say, you know, how much medical information they could get. They wanted to take that a step further and do the genetic testing, then, you know, that's a future scenario of developing laws to control that, but it's not off the table. There's nothing to say that it's legal or illegal right now.
Well, racial discrimination is certainly illegal. So you don't have to.
Well, it has nothing to do with race.
Yeah,
You
but
know,
I'm
your
just
medical
saying.
condition doesn't particularly have anything to do with race.
Yeah, but from my point of view, is employers can't discriminate on you on anything that they might even find in your blood. They can't do it.
Oh, yes, they can. Yes, they can.
Yeah,
If,
they can.
if there are diseases that you have, they cannot employ you. They can send you to a doctor to get treated before they employ you. And Sylvia has a question, comment. Question.
I was just thinking, like Dr. Callender, what was the risk of Alzheimer's for African Americans 20 years ago compared to now? Because it makes me think something else is going on. You know, if the risk was lower 20 years ago and is so much higher now, I'm like,
But that's generally true anyway. It's generally true that the risk is increasing.
Yeah, but
and the reason is because you're aging. The biggest significant factor in Alzheimer's is aging. So because more people are living longer, more people are having Alzheimer's.
Okay.
And it could be because we're better at categorizing it. You know, like 100 years ago, we just said they got old and senile. Today, we say they got old and Alzheimer's.
Right.
Oh,
So true.
okay. I guess I was just thinking something else has got to be going on, but okay, you're saying it's aging.
Absolutely. Yeah.
So aging, and you're saying aging and a good diet, you know, eating healthy, will not prevent Alzheimer's?
I don't know anything that prevents Alzheimer's, but it is suggested that exercise, eating well, is likely to decrease the likelihood of getting Alzheimer's. And so healthy lifestyle, diet are things we do because we believe that there's evidence that groups that do that have less Alzheimer's, but it's still true. The biggest factor in the development of Alzheimer's is aging.
Oh, wow.
A third of the people who are over 80 have Alzheimer's.
And don't forget, we got on to this topic about Alzheimer's by the genetic testing issue. And
Yeah.
some of it is hereditary.
Yes. And that's why we talk about it, because since people know that this gene is increase the likelihood of Alzheimer's, we therefore people wanted to get tested to see if it's just like there was a test for Huntington's disease, and if you were positive, that meant that at the age of 40 you start going downhill, and you die probably by the time you're 50. Once the test became available, most of the people didn't want to be tested because there was nothing they could do about Huntington's disease. This is similar. with Alzheimer's, we don't know how to treat Alzheimer's. So that brings up the question, why find out if you have the genetic genes or not, if you can't do anything about it?
I guess this
Mike-
makes me, I'm sorry. Say, I guess this makes me think about getting, papers and financial, medical trustees or what do you call individuals who have the authority to to say if there's any medical treatment. I mean, get your paperwork in order in terms of life
Yeah.
expectancy. You know what I mean?
Yes.
You're
Yeah.
saying
Your power of attorney.
power of attorney. You're saying
Advance directive.
over 80. You're saying over 80 is where we really start to deteriorate with
Well,
Alzheimer's?
the evidence is that they start at 30, 40, 50. But people who have this gene have 8 to 12 times the
More.
higher likelihood of developing Alzheimer's than others. But the cognitive waning begins after 30, 40, 50. It just gets pretty high when you get to 80s. And that's why we started off the program talking about the super ages.
Yes.
Okay, check this out. Harvard University, cutting back on ultra processed foods linked with lower risk of later developing dementia and Alzheimer's. Here's another article from Pathways Home Health and Hospice. It says, avoiding foods that hamper your memory can only help you out later in life when Alzheimer's has a tendency to creep in. Avoid white bread, pasta, processed meats, and cheeses, which have all been linked to Alzheimer's disease. Our foods 100 years ago were a whole lot better than they are today, because today there's a high prevalence of processed foods, preservatives, antibiotics, and pesticides in our foods that we didn't have 100 years ago. Our foods are killing us.
And the evidence is clear.
Yeah.
Okay, well, I think we've had a appropriate discussion on this because it's something that we should be aware of. We talked last week about this article that was in the Post, and so John Buchanan picked up this article that talks about the crisis in men's health. Wherever you go, from infancy to teen years, midlife and old, boys and men are more likely to die than girls and women. And this is something that is getting worse all the time. And so while we have offices for women's health, we need to have an office for men's health, because that's where the problem lies. And that's why wives outlive husbands and spend all the money that the husbands make. Yeah, we say it in jest, but that's often true. And so at every age, mortality is higher in men than women at all stages of life. That's hard to digest, but it's a fact of life, and it's kind of scary, but reality. And so what it means is that maybe we need to have the women to take their husbands to the doctor or their sons to the doctor and whatever, because and also all of the healthy lifestyle changes that Darryl talked about. Make sure that that's evident for your men, for your males in your life, because otherwise they're going to leave sooner than you, even for suicide. And of course, since COVID, teenage African-American males have a much higher risk for suicide. So this just heightens our information that we got to do something about our Black men so that they stop doing the wrong things and start adopting healthier lifestyles and diets. Any other comments? Darryl, any thoughts? What we do about our Black men?
Well, I forget the exact statistic, but I think it says that maybe a quarter of our Black men are either in the prison system or either in jail or have been in the prison system at any particular time.
Correct.
And I read a recent article that was saying that the medical treatment for chronic medical conditions is just about it's rare. Prisoners don't get treated.
Right. We just went over an article on that. As a
Right.
matter of fact.
And there's so many comorbidities. We just saw that asthma is high in prison in incarcerated populations, and there's a comorbidity with asthma and hypertension. And so you have prisoners who are not treated for their hypertension, and they get asthma as a result. The hypertension tends to scar the kidneys, and so they tend to have less effective kidneys, more prevalence of diabetes, and uh, mental illness is also not treated in prison. And prison makes you crazy because you're with crazy people in the first place, and it puts a lot of stress on you. And stress is a primary factor in short lifespan. So you have all these stressors on Black men. It's a wonder that we live as long as we do.
Yeah.
Yeah.
Well,
Dr.
well stated. Well stated. Any other comments? Yes, Sylvia.
Dr. Callender, I read that article in the Post and I cut it out so I can send it to my son.
Oh,
Just
good.
just so he'll know. I was like, oh my Lord, this is,
Frightening.
they don't have to put us in jail to kill us. Just wait around and we'll die off, won't we?
Well, we just die fast in jail.
Mm.
Yeah.
All right.
But stay out of jail, please. Yeah. Yeah. Okay, well, I think it's when we think in terms of the solution, of course, we are reminded even towards the end of life, the prostate problems with men. So
Dr. Callender, one of the solutions he did offer, he was just saying, be sure, that, men just be sure they have a primary doctor and they get their regular checkups and know their PSA and just do the health checkup is one good thing. Was one of the
I agree.
recommendations. One of the
Good advice.
recommendations.
It's good advice. Good advice. And it's just another article that reemphasizes something that we can't say too much. And the issue of structural racism, as Darryl mentioned, it cannot be overemphasized.
Dr. Callender, I don't think reassignment surgery is going to help.
You don't think what?
Reassignment surgery is going to help.
He needs to change his step.
Next one. Nobody suggested that, by the way. Nobody suggested that. So the question is, how else can we get our Black men to take care of themselves? And so, yes, structural racism is part of it, but we also recognize that there are things we can do to overcome everything. And so
Dr.
I
Callender,
think the mental health issue is an issue that we need to have more of our Black men to take advantage of that as well. Somebody had a comment, question.
yeah, there was an article going around on Messenger about, I was trying to pull it up, but I'm not able to. Carol, are you on the line? Because you sent it to me and you also sent it to Daryl on Messenger, that article that says how institutional racism causes so much stress in the African American society.
Yeah, well, we can have that for next week to talk about it. Okay. So why don't you get it and send it to John, and we'll discuss it next week.
Right on.
This also was what we discussed last week. That was in the Washington Post. The fact that these are new genetic findings that are only found in men of African ancestry. What was surprising about it was it was found in a European journal, and they had genetic data on 80,000 men of African descent compared with another 80,000 men, and it pointed out that it had some cancer diseases that are only found in Black men. And so, and it concluded that PSA tests can be done as well as digital rectal examination. But that these should be looked for at the age of 45. Before we're looking at the age of 50, but in African American males, this should be done at the age of 45.
Mm.
So that's another thing. You can tell your Black children and grandchildren that get your PSA and your digital rectal examination to see if your prostate is normal or abnormal. Bacterial meningitis is a disease that's killed many. It's not as common as it used to be, and it is contagious. So whenever it occurs, it's important for it to be identified so that antibiotics can be available. And there are preventative antibiotics. And usually it presents itself with headache, fever, chills, and change of sensorium. But headache is one of the earliest manifestations of meningitis. And these are some of the bacteria that cause it, and death can occur rapidly. And so whenever you have somebody who has a headache and a fever, this is cause for them to go to the emergency room and be treated. That can be life-saving. And it is spread from person to person. So it's important to be aware of it. And these are the signs they're showing you: fever, headache, stiff neck, some nausea and vomiting, change in mental status, confusion. Yeah. How worried you should be, I think any teenager has a headache and doesn't go away and has a fever, considered meningitis until proven otherwise. And this has to be done quickly.
Dr. Callender, isn't there a vaccination for meningitis?
Yes, there's a vaccination. And they recommend it, but it's rarely done until people find out that there's disease going around and they do it. But yes, there's this vaccine, but it's not part of the normal vaccination process. in most circumstances. This is an article that I thought was very important because high blood pressure is the #2 cause of kidney disease, and a very important cause of cardiovascular disease. And in terms of what causes high blood pressure, there's so many factors. Stress, of course, is one of them. Obesity, diabetes, and other issues. And some people think sleep issues. I haven't seen a lot of data on the sleep issue. But we do know that once you have it, untreated, it becomes lethal, deadly. And that what then becomes important is to monitor it, measure it, and treat it. And there are many ways to drop the blood pressure. Sometimes medication is necessary. Sometimes it's just change of diet, exercise, weight loss. That's often the first step. But if that does not do it, then limiting salt intake becomes another mechanism. And of course, exercising, as we've talked about ad nauseum, 150 minutes exercise every week. And then, of course, antihypertensive medications. And the thing that becomes more important than anything else is not whether or not you have high blood pressure, but whether or not you're treating high blood pressure, and if after the treatment your blood pressure is normalized. Because if you're taking blood pressure medicine and your blood pressure is not normalized, you're not doing anything. And so it's important, therefore, to not only take the medication, but measure your blood pressure as necessary so that you're sure that your blood pressure is normalized. And when we say normalized, we want to say at least less than 140/90. Some say that it should be 120/80, but it's certainly at least less than 140/90. And if the medication you're taking does not get you there, then you're not adequately treated, and you need to be seen by a doctor that will get you adequately treated. Because just because you're treated for hypertension, if your blood pressure is not normalized, you can still have a stroke and heart attack and die. So it's important, therefore, to monitor your blood pressure. And whether it's monitored by you at home or by your doctor isn't as important as the fact that it is required to be monitored. Getting your pressure and monitoring it twice a day to be sure that your pressure is under 140/90 becomes life-saving. One of the things that we may not have mentioned, it was in some of the articles last week, is that, and we mentioned it last week, that the COVID vaccinations, booster shots, are available now for people who are over 65 and people who are immunocompromised. So that it hasn't been a whole lot of emphasis put on this, but those of us who have received booster shots more than 6 months ago, it's time for another booster shot. So along with the getting your blood pressure treated, also consider the need for getting another booster shot. Now, this is an issue that people over 50 have to be aware of, that many of us don't drink enough water. And most people would say that 8 to 12 glasses of water a day is the minimum. But if your urine is dark brown, then you're probably not getting enough water. If your urine is light yellow, you probably are. But 8 to 12 glasses of water a day is probably good enough. How many of us? Yes, Darrell, go ahead.
Dr. Callender, backing up to the previous article on hypertension.
Yes.
One of the comments we made about one of the reactions to a COVID-19 infection, a common reaction was elevated blood sugar. And we talked about that. We said one of the most common reactions to inflammation in the body was diabetic conditions, including elevated blood sugar. And, you know, I know that diabetes and hypertension are very much related. And I was wondering if some of the causes, if they have some mutual causes, like, say, inflammation. And I was just reading that says, in terms of hypertension, recent evidence suggests that inflammation can lead to the development of hypertension. And some of the fastest ways to reduce inflammation in the body and lower blood pressure can be to load up on anti-inflammatory foods, cut back or eliminate inflammatory foods, control blood sugar, make time to exercise, lose weight, and manage stress. But you know, that's possibly an area that we could concentrate on for healthy living, for controlling the amount of inflammatory foods that we eat, because that might help control hypertension and diabetes.
Well stated. Well stated. Okay. So I guess the emphasis of this article is that we need to stay adequately hydrated as well, especially as we're coming into the summer season when you get overheated and dehydrated. So keep your water bottle with you. Staying hydrated is an important part of health.
Dr. Callender, this is Sylvia again. I had a question when I drink a lot of water, and I was talking to a friend, and I said, well, why is my urine so clean and clear? Is your urine supposed to look like your water you drink in it?
If you're adequately hydrated, it could. But you know, we have a special urine test. It's called specific gravity. And if your urine specific gravity is between 1010 and 1020, then that's good. If it's less than 110 and it's really like water, then it makes you wonder if your kidneys are working. But there's a urine test. They take the urine and look at the specific gravity. And as long as the specific gravity is more than 1010, then you're likely okay. But it's not bad for your kidney to look like water. I mean, for your urine to look like water.
Mm-hmm.
But it's important, if it always looks that way, that it means you're well hydrated. But you want to be sure that your kidneys have a specific gravity that's better than 1010. That answers the question.
Yeah, I noticed when I do drink the water that I'm supposed to, at least 4 or 5 bottles, 16-ounce bottles, it's clear. And then when I don't, I had the Medicare wellness exam recently, and I got the results. It just said urine was yellow.
Good. But they usually do specific gravity. Well, at least they used to. Nowadays they're so modern, they may not do it. But there's a specific gravity that identifies whether or not your urine specific gravity is. If it's better than 1010, then your kidneys are working well. If it's under 1010 or less, then that may suggest. But if it was yellow, you're in good shape.
But I think it was yellow because I didn't have the opportunity to drink all the water because it was early in the morning.
Good,
But when I do drink my water and I go to the restroom,
good,
it's clear.
wonderful.
Oh,
You're healthy.
so the young lady indicated your urine is supposed to always be clear?
If you're adequately hydrated,
Okay.
yes.
Thank
And
you.
this article is talking about the fact that most of us are not drinking enough water today. And so you're not adequately hydrated. Yeah. So you're doing right. You're doing a good thing.
Well, I
Okay,
can't wait for the next topic. I think you mentioned one of the top topics going to be constipation coming up. Is that correct?
Oh yeah, we gotta change the date on that. Yeah, but that
Okay.
is a topic that we're going to address because there are a number of people who are over the age of 50 who have constipation chronically and don't know how to take care of it. So that's going to be a topic that we're going to try to face. I've asked one of our specialists to talk to us about that.
Okay. Thank you.
Sleep deprivation. We've talked ad nauseum about the fact that 7 to 9 hours is the minimum, and greater than 9 hours is not so good either. We talked about the fact that sleeping allows your brain to metabolize the poisons and the toxins, and so that sleeping is important, especially for brain health, and as we talk about trying to prevent Alzheimer's. How much sleep you need? 7 to 9 hours, what is recommended. Some people need more, some people less, although more than 9 hours is not recommended. And I remember one of our members used to sleep more than 10 to 11 hours until the COVID came along. Now, these are things that you might do to try to sleep well. And if you don't sleep well, these are some of the things that happen. You have a slow response time. Memory's not good, especially if you meditate a lot. It's difficult to meditate. You eat too much. That's one of the things that is very common when you don't get enough sleep. You eat too much. And making decisions, whether they're big or small decisions, become not as easy as they used to be. Regulating your emotions becomes an issue. They say you have a short fuse, you're harder to get along with. And this is all related to the fact that your brain is not eliminating those poisons. All right, and so how do you cope? It's interesting that they address this because few people address this. Get out in the fresh air. Listen to music. You musicians play a major role in helping us. I don't know about Taylor Swift's music, but music in general. Yeah. And your entire brain lights up with neuronal activity. As John Tatum talked about his mother and responding to music when she was ill. And it's interesting. Caffeine wakes you up. That's why people drink coffee every day, because they want to wake up rather than getting enough sleep. And so having a consistent sleep and wake schedule is important, but it's not always easy to do. But it's something that helps. And I think that some say exercising helps in terms of allowing you to, I exercise for early in the morning, but some people exercise in the evening, and that sometimes makes it easier for you to sleep at night. Anybody else have any issues about sleeping? Because that then Any comments or questions about that article on
Yeah,
TV?
got a comment. TV and screen watching, like watching your computer, those are sleep wreckers. They wreck the quality of your sleep. You don't sleep as long. You don't sleep as well. You don't get the restful REM sleep. So, they say at least a couple of hours before bedtime, try to stay away from the TV and computer screens. Um, you can do some things, some much better things to pass the time and get good quality of sleep, like having sex, or if you don't feel like that, playing a board game like AC Doocy, Monopoly, or whatever. But keep your heads out of the screen, have some activities, and you'll live a far better life.
Okay, next article, please. Now, this is something that I thought was important, that our president is putting in place a $1.1 billion program to keep the vaccines free for those people who don't have insurance. I think that's important. Of course, 1.1 billion is a lot of money, but I think that's good to know, because in 2024, as well as in 2023, the COVID vaccine, as well as the other vaccines, are going to be important. So it's good to know that. Now the question is, will this continue? Because what's the election year? Is it 2024?
24.
Yeah.
Yeah,
So
that's when Trump is gonna get elected again.
he might be in jail, so I don't know. He can't
Let's
be
hope
president
so.
from jail. So, but anyway, so that's right around the corner. Whether the Republicans or Democrats get in becomes an issue. But be that as it may, today, the funds are there to cover the COVID vaccine. So those who need boosters, you can get them.
Dr. Callender, Carol and I getting ready to get our other booster. And, make sure you guys, when you go online, CVS/booster, make sure you have your Medicare card and the number.
Okay, I guess this will be the last article. It's 10:30. I didn't realize time was going so fast. Tinnitus, that's a disease where you hear ringing in your ears, and it's not fun. Those of you who've had it recognize that you talk about stress. That's stress. And it's ringing as day and night, and it's associated with other symptoms as well. And some significant number of people have developed after the first dose of the vaccine. And we still are not exactly sure why it happens, but we know that millions have been vaccinated, but 16,000 people out of those people have developed tinnitus, and it's not fun. And this was thought to be more common than the myocarditis, which is less common. Well, it's essentially that some people never get over it, which is frightening, because I had it for a short while, and it was horrifying. I mean, it only lasted for hours, but can you imagine somebody has it like Chris has had it for years now.
Yeah.
And
Con-
so,
Well, Beethoven had it too.
yeah, what was Beethoven related to?
His death.
Lead poisoning or what?
I'm not sure of the cause, but the last years of his life, he heard a concert A, and that was the theme of his Ninth Symphony.
Uh,
Yeah, I have tinnitus. Had it for several years, not related to the vaccination at all, but it takes up a lot of space in my head. I've learned pretty much to ignore it, but it's not too loud, but it's definitely there
every day?
right now. Yes,
Mm.
all the time.
So you learned
I
how
have
to,
it too.
you've learned how to tune it out too?
I guess you ignore it, but
Yeah,
it lowers your quality of hearing because it gets in the way of normal audiation.
Mm.
I'm not sure if I have mine from the vaccine, or because I was a dental assistant and hearing that high pitched noise, or going to concerts, loud music. So whatever the reason, I have it, but I can mainly ignore it. I think it became more obvious though to me during the pandemic. I could actually hear it.
Well, I know it's to say the least, it's a bother. And it's amazing that people are able to overcome it,
Mhm.
as you have. Essentially, he says meditative prayer is helpful. And if you find that out to be true, anyway, there's, as he says, there's no standard proven ways of treating it.
Talk about like maybe yoga, something like that.
So far, there's no standard way of treating it. So. Oh, you mean what he's talking about here? I don't know. I don't know. Has any of you tried any of that?
No.
No.
John, you take yoga. Has it helped you with your tinnitus?
No,
Okay, I think that's the last article we'll do for today. So, any other topics you wanted to? We'll talk about those next time. Okay. All right.
Ozempic, yeah, we'll talk about that.
We'll talk about all those next time.
Okay.
Okay, those are the last article. Okay. Yes, Doctor. I told you had to say something.
Yes, I was just thinking about the incidence of the bacterial meningitis, with the teacher who contracted that infection and subsequently passed on. My concern is, was it a misdiagnosed condition, or the teacher failed to present his case before a doctor? Because these infections, bacterial infections, they are commonly treated with antibiotics nowadays. I wonder how this could have happened to a teacher.
Easy, because you can have a headache and just think it's the headache. And bacterial meningitis can kill you within a matter of hours. So if you have a headache and fever and don't go to the doctor, decide to go to bed and sleep it off, you could conceivably never wake up. So that you need to have an early diagnosis and treatment unless you've taken the vaccine. So so what probably happened is that the teacher didn't recognize that this was not a simple headache.
Okay.
It was meningitis, and by the time she got treatment, it was too late.
Yeah, thank
Because
you.
you're right, they do have effective antibiotics, but you have to make the diagnosis in time and give treatment adequately.
All right, thank you.
Any other closing comments or questions? Not, thank you for your attendance. It's a great session, mutually learning and distributing information. Have a nice weekend.